Hello friends, today we're going to talk about vitamin D, creatine, and DHEA. Vitamin D. Vitamin D is a fat-soluble nutrient. It's one of the 24 micronutrients critical for human survival. The sun is the major natural source of the nutrient, but vitamin D is also found naturally in fish and eggs. Why you should take it? Supplemental vitamin D is associated with a wide range of benefits, including increased cognition, immune health, bone health, and well-being. Supplementation can also reduce the risks of cancer, heart disease, diabetes, and multiple sclerosis. The body produces vitamin D from cholesterol, provided there's an adequate amount of UV light from sun exposure. There is only a sufficient amount of UV light coming from the sun when the UV index is 3 or higher, which only occurs year-round near the equator, between the 37th parallels. Most people are not deficient in vitamin D, but they do not have an optimal level of vitamin D either. Due to the many health benefits of vitamin D, supplementation is encouraged if optimal levels are not present in the body. Vitamin D has often been researched in the context of male fertility. In fact, vitamin D receptors are located on sperm cells. Vitamin D may also play a role in the production of steroid hormones. Studies have shown that for men with low vitamin D levels, supplementing vitamin D over the course of a year resulted in an increase in testosterone levels. It is not known if this is due to fixing low testosterone or due to an inherent increase in testosterone, as the study was conducted in middle-aged men who may have experienced an age-related testosterone decline. Vitamin D is a base supplement because it is very safe, cheap, and guards against low testosterone levels. Most people do not get enough vitamin D. People living near the equator that get a lot of sun may not need to supplement vitamin D. Vitamin D should be supplemented throughout winter, since sun exposure is less frequent during cold seasons. People with darker skin tones will require more sun exposure than lighter-skinned people to get the same amount of vitamin D. How to take it? To supplement vitamin D, take between 2,000 to 3,000 IU a day. The lower end of the range are our usual recommended dose, while the higher end is similar to the dosages used in studies on vitamin D and testosterone. Vitamin D should be taken with meals containing dietary fat. It is sometimes taken in the morning due to anecdotal reports that it may impair sleep quality if taken too close to bedtime. Vitamin D3 supplementation, cholecalciferol, is recommended over D2 supplementation, ergo calciferol, since D3 is used more effectively in the body. Vitamin D should be taken daily, with meals or a source of fat, like fish oil. Vitamin D is a form of testosterone booster, an essential vitamin. Its primary function is for general health. It has other functions such as antioxidant, anti-inflammatory, immunity, bone and joint health, cognitive function, and brain health, insulin sensitivity, cardiovascular, libido, and sexual health. Goes well with calcium and vitamin K. Vitamin K may attenuate the risk for vitamin D overdosing. Creatine. Creatine is a small organic acid which serves as an energy intermediate, replenishing ATP levels in a cell faster than glucose or fatty acids. Why you should take it? It is most well known for its ability to increase the rate of muscle growth and improvements in strength during training. Creatine has been investigated for its interactions with androgens a few times, and in young men, 18 to 35 age bracket, it appears to cause a mild but reliable increase in testosterone concentrations by around 20 to 25%. This increase in testosterone is thought to be partially responsible for the effects of creatine on muscle growth and power output. Creatine is safe, but further research is needed to determine the mechanism through which it increases testosterone levels. More studies are needed to research creatine's effect on testosterone when supplemented by women. An increase in dihydrotestosterone, DHT, was observed in one study, but this has not been replicated. How to take it? The best way to supplement creatine is to take creatine monohydrate. Other forms of creatine may be more expensive, but studies have not found them to be more effective than creatine monohydrate. If you are particularly sensitive to creatine's digestive side effects, which include nausea and cramping, consider supplementing micronized creatine, which may be gentler on the digestive system. The standard daily dose for creatine is 5 grams a day. This is not enough to improve power output. People with more muscle mass may benefit from a higher daily dose, as much as 10 grams, but this claim is not fully supported by the evidence. To supplement 10 grams, split it into 2 doses of 5 grams during the day. Loading creatine means taking a high dose of creatine for a short period of time before moving down to a smaller maintenance dose, which can be taken indefinitely. This is not necessary for effective supplementation. Though loading may result in benefits appearing slightly faster, results normalize after a few weeks. Some people are creatine non-responders, which means creatine is unable to pass from their blood to their muscles. More research is needed to find a proven way to circumvent creatine non-response. Some evidence suggests it helps to take creatine with a meal high in both protein and carbohydrates, close to the time of exercise. If you experience creatine non-response, consider taking creatine with a meal, either before or after a workout. If you respond to creatine, you don't have to worry about timing supplementation, though you will probably want to take it with a meal to lower the risk of an upset stomach. DHEA. Why you should take it? Dihydroepiandrosterone, DHEA, is a compound needed to produce testosterone and estrogen. People with low hormone levels can supplement DHEA to increase testosterone and estrogen levels. DHEA does not act directly on the androgen or estrogen receptors. Instead, DHEA circulates throughout the body and can be called on by the body to create hormones as needed. Supplementing DHEA will not increase testosterone levels above normal. People with healthy hormone levels do not need to supplement DHEA. DHEA is most reliable when supplemented by people suffering from age-related low testosterone. As DHEA is a mild CYP3A4 inhibitor, it should not be used alongside pharmaceuticals that are metabolized by this enzyme. How to take it? To supplement with DHEA, in women, it may be recommended to use 25 to 50 milligrams of supplement, while in men, 50 to 100 milligrams once a day with a meal. However, this amount may vary according to the brand of the supplement and concentration per capsule. I hope you enjoyed the video. We'll be back with more content. Goodbye.